Okay, ready. Saya tak nampak muka saya. Memang tak nampak ke sebab poster?
Ada, kami nampak.
Oh, okay.
Okay, Assalamualaikum warahmatullahi wabarakatuh dan selamat petang. Saya ucapkan kepada semua hadirin dan hadirat yang dapat bersama-sama kita dalam Zoom meeting pada petang ini. Bukan Zoom meeting, dalam sesi CME pada petang ini ya. Selamat datang kami ucapkan ke salah satu lagi episod CME yang dibawakan oleh pihak Kerajaan Negeri Selangor melalui program SEHAT, iaitu program kesedaran kesihatan mental yang dikhususkan kepada rakyat Selangor dengan kerjasama Malaysian Psychiatrist Association dan International Islamic University Malaysia IIUM. Untuk hari ini, untuk CME kita pada hari ini, tajuknya ialah sangat-sangat dekat di hati kita semua sebab kita mungkin pernah berjumpa dengan mereka yang menjadi caregiver terhadap pesakit-pesakit kronik. Tidak semestinya pesakit mental sahaja, tetapi juga pelbagai penyakit kronik yang lain, terutamanya penyakit-penyakit yang menyebabkan seseorang itu tidak dapat menjaga diri sendiri. Contohnya mereka yang terlibat dengan stroke ataupun mereka yang terlantar sakit. Ya? Okay. Mereka ini kita kenali sebagai penjaga ataupun caregiver terhadap pesakit-pesakit kronik. Selalunya mereka ini dan juga ramai ahli keluarga lain amat mengambil berat terhadap kebajikan para pesakit. Tetapi siapa yang mengambil tanggungjawab untuk menjaga kebajikan ataupun untuk menjaga kesihatan mental para caregiver ini? Dan tidak mustahil para caregiver ini mungkin juga mengalami burnout ataupun stres ataupun untuk tahap yang lebih dahsyat lagi mereka juga mungkin mengalami kemurungan akibat terlalu penat ataupun tidak dapat menanggung lagi kebebanan terhadap kesihatan mental mereka. Pada sesi CME pada hari ini yang bertajuk I Need Help Too. Ini ditujukan khas kepada para penjaga ataupun caregiver untuk pesakit-pesakit kronik. Dan juga untuk mereka yang tidak terlibat secara langsung sebagai caregiver, sesi CME ini juga merupakan salah satu platform untuk kita mempelajari sesuatu bagaimana untuk memberikan support terhadap para caregiver ini. Untuk itu kita bersama-sama kita pada hari ini sekali lagi Dr. Syuhaida, seorang pakar psikiatri daripada Hospital Shah Alam yang akan membincangkan dan juga memberi serba sedikit tunjuk ajar kepada kita bagaimana untuk memberi support untuk menjadi salah satu daripada support system kepada para caregiver ini. Untuk itu saya persilakan Dr. Syuhaida.
Terima kasih pada Dr. Nur Faiza. Terima kasih kepada semua yang hadir. Terima kasih SEHAT MPA kerana menjemput saya. Sekali lagi kita bersama dalam sesi CME dan today adalah tajuk I Need Help Too. Saya Dr. Syuhaida Abdul Razak, pakar psikiatri Hospital Shah Alam. Okey, sekejap saya share dulu. Nampak kan?
Belum keluar lagi.
Oh, belum keluar. Okey.
Okey dah keluar.
Alright. Okay. Alright, I need help too. Okay, okay, I like this topic. So basically, because usually we forget to talk about the caregivers. We always talk about the disease. We always talk about the patient. Tapi saya selalu cakap juga, macam patient dah memang patient dah memang sakit dah. So, but the rest is for the caregiver, kan? Then the rest is for those who actually taking care of the patient, because at the end of the day, the patient is already have the challenges itself. Patient tu dah memang sakit, kan? I would say that it is dugaan lah untuk whatever illnesses that the patient have. Okay, whether it is a chronic illnesses, whether it is a newly diagnosable illnesses, or the patient okay, tak ada masalah, and suddenly has accident and got fracture. So despite it is it is temporary, but the temporary also is a nightmare for the patient and the caregiver. So I'll start with a story with a friend of mine. I hope that she's okay of me sharing this, sharing her story. But actually, I already shared this in my Facebook, which is, I think, 4 to 5 years ago, where we were still study master, and we okay, she was with me during master study, and I sat just next to her or in the common room during the master study, during the first year, second year. We go through our first year, second year together, and it is, we were close. Okay, we were close, and we have a group of friends which we clicked to. All right, and during our third year, or I think after third year, if I'm not mistaken, I can't really remember the timeline, but she got down with the dengue fever. Okay, she got down with the dengue fever, and I still remember that she still WhatsApp us, yeah, through the group. So we have a group together that bagi tahu yang, and she was pregnant at that time, about 8 months of pregnancy, and is a and yeah, and she got this dengue fever, and initially we thought that okay, tak ada apa-apa lah, dengue fever, admitted to the ward. And she said that sesak nafas, and then after that malam tu dia kata a bit restless, okay, dia panas, dia bagi tahu macam tu lah, okay. And suddenly the message from her dah senyap, and the husband mentioned that she was ventilated, okay. And yeah, it was a shock.
Ya, Dr. Shu.
Yep.
Memang slide tak bergerak ke?
Tak, memang saya tak gerak slide. And we was and we were shocked to know that she was intubated and ventilated for the dengue fever, and the rest is all the trauma that we have, okay. And of course the trauma to the husband also, and she deteriorated quite fast. The baby that she's pregnant with passed away passed away, and it is a matter of to remove the baby, but she has a coagulation problem, so it is a bit, and also because of the dengue fever, so the platelet is not very good, so it is quite dangerous to remove the baby through any savagem or any other means. So but to leave the baby inside the stomach also is another issue of sepsis. But and she was quite severe enough, and she needed a dialysis, multi-organ failure, and I think we cried each time we saw her in the ICU. At that time, still not COVID time yet, so we were still able to see her, and she was very swollen, yellowish, because of all the liver failure, and but the baby decided to help her. Yeah, I mean, I think Allah decided to help, in which the baby suddenly come out herself, right? Come out herself, and 1 month plus in the ICU, she finally able to come out from the intubation. We able to extubated her. She gone through the delirium, and of course, she did not remember that, but the husband remember all. The husband not even able to go back to the flat, I mean to the apartment where they live, because of the traumatic because of the dengue fever, because he believed that the mosquitoes from that apartment is actually the one that made it. The husband cannot sleep for the past 1 month. The husband is the one who actually see and hear the prognosis. For each time the doctor said anything, the husband will actually come to us and ask what should he do. And he was not able to go back to the house, just sleep, very light sleep. And even after the incident also, the husband has a problem in forgetting all those moments, and in which he was a bit hypervigilant in terms of this. So I would always say that, yeah, the patient is the patient. The patient is there. That is the problem with the patient. Means that the patient memang dah ada masalah. The patient dah memang sakit. But who else need the help? Is the caregiver. So it's the caregiver that we need to take care of too. All right. And it's the caregiver that we need to ask whether they are okay or whether we are not okay. Whether they are not okay. For any diagnosis. Okay. For my friend, the diagnosis was very acute. But what if the diagnosis is severe, right? I mean, chronic, like dementia or the diabetes, okay, the diabetes that need bilateral knee amputation, yeah. And what about the heart problem and so on. So for any diagnosis, and yeah, the caregiver is the one that we need to take care too. All right. Of course, the mental illness is the thing that I will talk about more, but takkan terlepas pun apa-apa diagnosis sekalipun. Ya, semua diagnosis. Kalau dia tahu diabetik, tapi mak dia tak control makan sugar, and we know that the mother mungkin apa jenis yang macam tak boleh nak ignore makan sugar. This is not the new thing tau. Banyak kes yang saya jumpa, okay, banyak. Mak dah kencing manis, tapi macam tak boleh, selagi tak minum benda manis, lagi itulah mak dia tak puas hati. So yang kena marah tu adalah caregiver lah yang jaga tu. And recently I think baru viral kan, ada budak tu minta tolong. I'm 15 years old, the father passed away, I'm taking care of my mother. My mother recently ada buat operation because of macam I think the amputation lah over the macam below knee. Sorry, below ankle, dekat ankle amputation. I tak sure extent of the amputation, tapi budak tu tanya tolong lah, tapi mak dia buat roti kosong untuk mak dia, tetapi mak dia still nak makan manis-manis. So apa nasihat yang patut dibuat for any diagnosis? And again, the patient is a patient, but the caregiver is the one that we need to take care of too, right? So I suka tengok cerita hantu. I always like to see ghost movie, and almost every day I need to find I need to tengok cerita hantu lah. I kena tengok cerita hantu sebab it makes me sleep easily. Why? Sebab I tak payah fikir banyak pun pasal cerita hantu. I tahu dia akan masuk rumah kosong, rumah hitam, and then after that gelap-gelap. Dia tak ada siang punya kalau cerita hantu. Adalah sekali-sekala siang, but most of the time is at night. Dan I boleh tertidur dengan lengan. Alright, but I like this story, Dendam Orang Mati, which is Lisa Surihani and Fiz Virus, yeah, and lakon KRU punya studio. Why? Sebab they are talking about, kalau kita tak perasan mungkin kita nampak memang macam dendam orang mati lah, tapi memang nampak macam mistik sangat cerita ni. But it's all because of the diagnosis is schizophrenia, and the wife is suffered from the schizophrenia, and we can see that through this story that the husband also suffered the most in terms of when the patient is paranoid, patient talking bad about the husband, so the husband endure everything. The husband tried to save the wife during the kebakaran, the fire, and then the fire was started by actually the wife actually having the paranoid and so on. So we can see that is the caregiver also is affected the most. Yeah, not from this story also. I think a lot of other story also depicting this, but we forget to see how the caregiver is frequently affected, because we commonly see how the patient is mostly affected. And I can see the pain from your smile, and I think whoever follows my previous talk, I already talk about this story. So this is a girl, 14 years old, 14 tahun, baru nak terjun bangunan sekolah, and admitted to our emergency. And according to the patient, that she was very stressed because of the divorce. I mean the parent and mother recently divorced, I think about 4 months ago, and she feels very sad because of that. And again, with the body shaming from the friends at school, so they called her dugong. So they called her dugong, they called her katak puru, and so on. And I tengok dia tak adalah katak puru sangat, tak adalah dugong pun okey je. I rasa I lebih dugong kot daripada dia. Kalau dia nak cakap dugong tu apa dia punya body weight lah, I rasa I lebih dugong kot. I rasa badan dia okey je. And the mother is macam Chinese look. So she's sweet girl, sweet little girl, tapi itulah orang kata muka dia macam katak puru, which I can't see any macam acne marks ke apa ke. I'm not sure why the term of body shaming came into places, but again, she was very depressed because of the parental divorce, and she decided to end her life because she don't want to think about that anymore. But she was managed to be saved by the counselor, the school counselor, and was sent to the hospital. So these cases when my MO discussed with me, so I kata I nak tengok mak dia. I nak tengok mak dia. So anak dia tak apalah, you tengoklah. I kata I nak tengok mak dia. So the moment I see the mother, and of course the mother will think that mak dia akan fikir yang saya nak tanya pasal anak dia. So the moment masuk bilik dia, saya tanya, how are you, Puan? Oh, anak saya ni macam ni. Tak, Puan, saya tanya apa khabar, Puan? Doktor masih nak tanya pasal anak saya kan? Anak saya ni dia memang sejak dulu dia begini. Tak, saya tanya pasal Puan. Saya tanya, Puan okey ke? Are you okay? Doktor tanya pasal saya. Ya, saya tanya pasal you. Saya, tak apa, anak you dah selamat dah dekat ED tu. Saya cuma nak tanya Puan. Puan okey ke tak okey? Dia terus menangis. Tak pernah orang tanya macam tu, doktor. Saya dua kerja dalam satu masa, untuk support anak. Ayah dia memang nampak baik, memang selalu solat sama-sama dengan anak, because ayah dia selalu je buat hutang dan so on. Saya yang nak kena bayar hutang, tapi ayah tak buat apa-apa. Jadi bila saya membebel-bebel, anak nampak macam saya yang membebel, saya yang garang dengan anak. Ayah dia mungkin ada banyak masa sebab ayah tak buat apa-apa pun. Yang hutang saya yang kena handle, hutang along saya yang kena handle. So saya terpaksa buat kerja dua masa. Bila balik saya penat, saya letih. Ayah dia kata jangan buat macam tu, jangan jadi macam mak, marah-marah macam tu. And I mean the whole conversation is talking about the mother, and the mother feel better when we actually acknowledge the emotion. So that last kali dia tanya, apa yang patut saya buat, doktor, untuk anak saya? And this is the important. When we acknowledge the caregiver burden, we acknowledge what is the caregiver is actually facing, so we actually able to gain the control over the caregiver, means that the caregiver able to control their emotion, and they can actually menjaga dengan lebih baik. Kalau kita tak tahu, kita biar je dia, harung je, okey tak apalah, sabar ya, anak puan ni kena tengok dia daripada dia macam cubaan bunuh diri, kena jauhkan dia daripada benda-benda yang tajam dan sebagainya, kena jauhkan dia. Yes, but who is the one yang akan validate the mother's emotion? Who is the one yang validate? I have a new patient juga recently where the father passed away. She was very close to the father. Dia datang, dia senyum. Doktor, saya okey je kan? Cuba doktor tengok. Saya okey je kan? Saya tak ada masalah pun kan? Saya sebenarnya saya cuba untuk kuatkan hati saya okey. Dan doktor nampak macam saya sekarang, saya tak ada isu pun. No, I can see that. I can see the pain from your smile. I know that you are suffering. I know that you are in pain, but you tried to hide it from me. And again, she cried dan dia nangis. Doktor, sebenarnya saya betul-betul tak kuat. My father sakit, and I have to take care of my mother who is sick. And again, the story goes on. So when we actually able to acknowledge that the caregiver is also the one who is also having a painful moment, so they actually can care, they actually boleh menjaga dengan lebih baik. Alright. So this is one of the case. Jane is a 55 years old lady who cares for her son with schizophrenia, and we know that the schizophrenia is a chronic mental illnesses. And when Jane is asked about any difficulties in caring for her son, she becomes tearful, as nobody has ever asked her about her feelings before. And Jane believed that caring for her son is like carrying a heavy load, because sometimes she cannot cope with the demands of the caregiving. And as a result, she always feel overworked, stressed, angry and dissatisfied. Biasanya caregiver memang akan ada emotion macam ni, overworked, stressed, angry, dissatisfied. Tapi bila cerita dekat orang, apa yang orang cakap? Sabarlah, sabarlah, ini kan semua ujian. Yes, memang dia boleh sabar. Kalau dia tak sabar, bertahun-tahun dah dia jaga patient skizofrenia. Kalau dia tak sabar, macam-macam dah benda yang dia buat. Ya, but dia tak nak pun kata-kata nasihat yang sebegitu. They just wanted to be validated. Faham? I can see that you are stressed. I can see you are angry. It's okay for you to get angry. Kalau I kat tempat you pun, I rasa nak marah. Kalau dia main air 24 jam, kita takut dia jatuh, kita takut dia tergelincir. Kalau I pun rasa tak puas hati, kenapa I yang kena jaga? Padahal, okay, the husband pun anak dia juga. Kenapa husband tak peduli pun, kenapa you yang kena jaga? So, yeah, it's part of the emotional validation. Again, kita nampak macam, oh, you sekali pula dengan patient kan? Again, when we do the emotional validation, there's a skill about that. Maksudnya, you follow je the train of thought to the patient tu, but later on kita tarik balik. Kita tarik slow-slow. Bila dia dah ada rapport dengan you, dan kita tarik balik slow-slow. Betul, rasa nak marah, rasa geram, patutnya ayah dia pun tolong sekali. But, she only have you. He only have you. Right now, he only have you. So, I can see that how strong you are. I know bukan semua orang boleh ada kekuatan yang macam you. Not everyone. But you have done this so far. And you have achieved up to this level, up to now. I know you akan rasa stress, balik pun rasa macam overwork, tengok dia. But you know, you have help. You know that you can always talk to me. And again, for the cases yang jaga chronic mental illness macam ni, I akan panggil the family members juga. Sebab kalau kita panggil patient je, tapi family members tak faham, there's no point of doing that. Because at the end of the day, diorang takkan faham tentang ubat, diorang takkan faham about macam mana nak caring for the patient. Again, diorang akan rasa marah, akan rasa menyampah, akan rasa benci, dan at the end of the day, this has become their burnout and depression. Okay, for this Jane, she also suffered a great deal of shame and embarrassment associated with her son's behavior problem. Jane shared her experience of her son's behavior problem. Yesterday, he took off his clothes in the shopping mall where there were a lot of people. It was such an embarrassing situation. Furthermore, the people around, they were telling others that I am his mother. I feel so embarrassed. Kenapa? Sebab bila orang cakap, tu lama dia. So apa yang patient tu rasa macam orang nak kata, I tak pandai jaga anak lah. But they don't know that the child is having a schizophrenia. So you know, all this ditelan disimpan dalam diri sendiri, then actually it really affected the caregiver mental health. And devoting your life to caring for another person will take a toll on your mental health. Of course, seeing them suffer, seeing them in the hospital, seeing them macam kena dialysis, like my friend's husband, seeing the wife kena dialysis, seeing the wife and dia kena buat decision yang waktu tu dah DNR, do not resuscitate, whether nak resuscitate ataupun tak, and the husband is the one that need to make a decision, is the one that take a toll into the mental health. Betapa susahnya nak sign borang untuk sama ada untuk berhentikan CPR ataupun tidak berhentikan CPR. It is not easy and it will become a traumatic moment. And the American population aging, by the 2040, the number of citizens over age of 65 will have more than double compared to 2020. And I think the Malaysian scenario is almost the same. And you know, when there is a lot of citizens over the age, who is the one who is going to care for them? Yeah, and of course, when the aging population is increasing, the dementia is also increasing. Caregiving by numbers. Why is it vital for those giving care to take care of themselves too? Because 43 million, nearly 1 in 5 Americans serve as an unpaid caregiver. Ialah parent anak sendiri yang jaga kan. 24 hours average time caregivers help family members and friends each week. 2 in 5 caregivers consider their roles to be highly stressful. 17% of caregivers who describe their health as bad or poor. And baru-baru ni I ada mental retardation, intellectual disability. Actually, this girl was taken care by the rumah kebajikan, and finally the family, which is the abang, decided untuk bawa dia balik lah after the mother passed away. And Bila dia balik umur dia dah 46, nak dekat 50, tapi perangai macam 5 years old. So selalu keluar rumah, selalu simpan barang-barang macam budak 5 tahun, letak barang dalam beg, lepas tu letak dalam bilik, letak dalam beg, lepas tu bawa ke mana-mana pergi, and then lepas tu degil. This is what dia punya wording lah, degil lah doktor. Dia ni degil sebab apa? Budak 5 years kan bila orang kata buat macam ni, no, tak nak. Buat macam tak nak. Kalau dia kata tak nak, tak nak. So it's almost equals dengan dia punya mental age is around 5. So diorang, tapi each time kita bercakap, I tak tanya banyak pasal patient tu, because the patient memang intellectual disability. Memang dia tak boleh nak cakap banyak pun. Kalau tanya pun baju dia warna apa, baju dia warna putih, warna biru, pun tak kenal warna jugalah. Okey, dia ada lagi warna pink yang glaring tu dia tak sebut warna pink, warna biru dia sebut, padahal biru tu sikit je dekat baju dia. Okay, but when we ask about the caregiver, bila kita cerita, oh betul memang umur dia macam tu, umur dia macam 5 tahun, oh patutlah doktor, patutlah dia punya perangai macam ni. Bila kita cakap dia macam susah nak faham, kita kena cakap slow-slow, kena cakap slow-slow, satu-satu, one by one. Itulah doktor, betul, tetapi saya pun jaga mak yang dah tua. Ya, saya pun dah jaga mak yang tua. Bila mak terjaga, dia pun dah terjaga. Bila dia terjaga, dia mulalah buat bising. Jadi macam the one yang caretaking tu pun umur dia dah 60 to 70 years old. And dia pula dah 60 years old, 50 something. The mother pun dah 80 plus something. So just imagine how the caregiving is actually very burdensome. But bila kita bila kita selalu tanya, so the caregiver akan rasa empowered. Oh tak apalah, jadi memang macam itulah doktor perangai dia. Saya ingat dia akan baik semula, dia akan okey sebentar, dia tak akan okey, dia akan jadi macam tu, mungkin akan worse. Yeah, but you need to be prepared for that. It's like a fuelless car. So taking care of the mental health, so taking care of the people yang chronic diseases, taking care of the people yang memang bad mouth, it's like fuelless car. So you just imagine this is what burnout feel. Kalau kita kata stress, apa itu stress? Stress ni satu tekanan. So bila kita ada tekanan, kita masih boleh move, kita masih boleh tolak kereta tu, kita masih boleh tolak, kita boleh push ourselves. Tapi bila kita tak ada tekanan ataupun force dah tak ada kan, bila dah force dah tak ada, kita namakan dia burnout. Burnout ni macam kereta yang tak ada minyak. Okey, memanglah sejauh mana kita tolak pun kereta tu, kita boleh tolak. Tapi kita tahu tak ada stesen minyak pun dekat situ. Contohnya kereta dekat padang pasir, for example, the desert. So dekat situ kita tolak tahu, kita tahu dah tak, memang tak ada pun. Tak ada stesen minyak pun dekat situ. So at the end of the day, adakah kita akan terus menolak kereta tu? Adakah kita masih punya tenaga untuk menolak kereta tu? Dan adakah kereta tu tetap akan bergerak tanpa sebarang stres ataupun daya tolakkan? No. And this is what we call burnout. Bila mana kita dah tidak mampu untuk bergerak lagi, bila mana kita dah tak mampu untuk hadap lagi masalah itu, this is what we call burnout ataupun letih upaya. Stress is when you put in too much effort. Burnout is hard to put any effort because you dah tak ada fuel. You dah tak ada energy langsung untuk tolak kereta tu. So it's hard to put on any effort. And you feel your emotions more strongly when you're stressed. Stress lah. Stressnya, tensionnya, nak makan kek lah, nak makan itulah. But if you burn out, tahu, your emotions feel blunted. I don't know apa yang I nak. Sebab at the end of the day, dia dah rasa macam everything you did untuk tolak the car to sampai the destination dah tak ada makna dah. So your emotion feel blunted. You tak ada rasa macam perlu buat sesuatu because whatever you are doing is nothing. You feel hyperactive and anxious because with stress, you feel anxious. But kalau burn out, you feel drained and helpless. And stress, you have less energy. But burn out, you have less motivation. Less energy, but with still motivation, you still able to move. But if you have no motivation, okay, it's very hard to move. Even kalau kita nak motivation nak gerak tangan pun tak boleh because you dah tak ada motivation nak buat apa-apa. And it takes into a physical toll, but burn out, kalau stress ni rehat nanti dia akan okay, better. You akan the energy that depleted akan resolve, okay, akan come back to you. But for burnout, it takes an emotional toll. And letih upaya, letih daya, burnout, when it takes an emotional toll, so it takes the whole lots of life. Mental health problems affect not only patient but the family members and the community as well. And for a psychiatry, last time kan kalau kita tengok sistem psychiatry previously, everyone is the one who have a mental illness, they were put in the asylum. So we call institution. So siapa yang ada mental illness admit dekat institution. Macam kalau dulu kita ada Permai, kita ada Tanjung Rambutan kan, dulu kita panggil institution. Yeah, by I think 1970 plus kita dah start deinstitutionalization because we realize the patient with mental illnesses who are being kept in the asylum, they have an issue. Okay, they call institutional neurosis. So this institutional neurosis make the patient unable to do a lot of things. They become restricted in terms of whatever that they can do. Despite we know that actually patients with mental illness also have their own functioning, we can push their own functioning up to the limit. And this is why the deinstitutionalization comes in, where we wanted the patient to go out. I mean, not to be put in the institution or the asylum, but to go out into the community. So who is the one who need to care? Is of course from the caregivers or the family members. And furthermore, due to the chronic characteristic of mental illness, patients with mental illness, so they require long periods of care. Thus, caregivers are left with no choice. Nak hantar pada siapa? Kan? Nak hantar pada siapa? But they have to accommodate their life, adjusting their life, accommodating the change in taking care of the mental illnesses patient. And some caregivers were able to adapt to the new roles successfully, but others experienced a significant level of burden. And in the current healthcare system, informal caregivers of people with severe mental illness play a crucial role in influencing patient prognosis and reducing rates of hospital admission, relapse and episode of self-harm. Kita selalu tanya, ubat dia makan tak? Ubat dia bagi makan tak? Beri makan pukul berapa? Okay, make sure that you pegang ubat dia ya. Kalau tak dia nanti overdose ya. Jadi dan kita selalu cakap bahawa patient prognosis bergantung kepada patient supervision, family yang supervise. So who is the one, bila kita nak balik dengan siapa? Balik dengan family. Siapa yang nak supervise medication? Family. But who asks about the family? Okay, and the studies of caregivers have shown that caring for individuals with severe mental illness often impact all domains of caregivers' life, including work, leisure, income, physical and emotional health. Okay, just imagine ya, waktu siapa yang nak jaga caregiver. Contohnya kita nak jaga the parent yang ada dementia kan, the parent yang dah bedbound. Okay, so bukan senang kita nak cuti lama-lama sebab anak-anak pun ada kerja kan. So dia akan mengganggu work. Of course dia akan mengganggu income, and finally anak tu kata tak apalah, dia decide untuk berhenti kerja because tak ada orang boleh bagi cuti lama-lama. In fact dekat government pun berapa lama cuti yang kita boleh dapat untuk menjaga kan. And yeah, and of course it affect the physical and emotional health. Of course sebab kalau dah dementia, sometimes the mother boleh marah, boleh menjerit, boleh maki, boleh menggunakan perkataan-perkataan yang kesat, despite that was not before. But this is what happening. So diorang pun rasa, bila diorang tak faham the issue, the caregiver tak faham kenapa nak marah-marah, kenapa nak potong kuku pun nak marah-marah. Kuku pun bukannya sakit, tapi bila potong kuku menjerit, sakit lah kan. I mean, I sendiri ada pengalaman. I think my mom taking care of my grandmothers, passed away already, my grandmothers. But this is what my mothers always said. Dah potong kuku tapi dia marah-marah. Bila nak mandi pun dia tak bagi, dia marah, dia akan menjerit, dia akan menggunakan perkataan lucah dan sebagainya. Despite dulu bukan macam tu. Kan? Dulu bukan macam tu. Bila dementia, sometimes it worsen, it augmented the previous personality, and sometimes personality itu tak ada, tetapi dia datang dengan personality yang a bit disinhibited, depending where the area of dementia is. Yeah, the vascular stroke happen. And previous research finding also have shown that tiredness, sadness, and constant stress, uncertainties, and frustration were the common feeling of burden expressed by caregivers. Quite common untuk diorang rasa penat, sedih, letih. And in addition, unlike other chronic illnesses, ya, kalau kita cakap dementia, mungkin orang akan cakap, oh kesiannya jaga mak yang tua, jaga mak yang nyanyuk, memang kesian. Yes, of course yang menghadap tu lebih kesian lah, yang menghadap tu lebih merasa. Orang cuma boleh cakap, tetapi beban yang dipikul dekat bahu tu hanya orang tu sahaja yang tahu. But again, kan, as compared to other chronic illnesses, kalau jaga dementia, orang akan kata dia jaga mak dia nyanyuk, kan, kesian, ataupun jaga yang patah kaki, kesiannya lah, accident patah kaki. Yes, I know that everything is equally tired, but chronic illnesses like mental illnesses is often associated dengan stigma. Ya, often associated dengan stigma. Orang akan cakap mental illness ni sebab dia banyak dosa lah. Padan muka dia dulu banyak sangat berdosa, sebab itulah mental. Sebab itulah sakit gila. Because of, sebab dulu pernah banyak buat dosa. Sebab dulu lemah iman, tak baca Quran, tak banyak berzikir. Sebab itulah sakit mental. And the stigma is the one that attach not only society to the patient, but also to the caregivers of the patient. So again, this is what people always say. Itulah balasan Tuhan, kan? Balasan Tuhan atas kesalahan-kesalahan di masa lampau. Again, kayu berlukar banyak sesapnya, mati berlukar tandanya layu. Kayu terbakar nampak asapnya, hati terbakar siapa yang tahu. So, begitu juga orang katakan luka di hati tak nampak, kan? Luka di kaki nampak, luka di hati siapa yang tahu. Sakit fizikal, individual yang sedang berjuang melawan kesakitan fizikal, ya. Come on, ya, you are good to go, ya, you are berani, cekal. Wah, susahnya menghadap masalah ni, patah kaki, susah nak bergerak, susah nak jalan. Yes, but penyakit fizikal ni akan dijaga dan disokong. Again, it is not easy. I would say it is not easy, ya, sebab kalau ada yang accident tetapi melibatkan kecederaan otak dan sebagainya, again, sejauh mana sangat kita puji. Kita boleh puji, kita boleh sokong, tetapi tak akan ada orang yang mampu berada bersama-sama dengan caregiver. Kan, boleh puji, boleh appreciate, yes, tetapi yang mengalami, the caregiver is the one yang mengalami. Kadang-kadang kita tengok bersamamu, kadang-kadang bukannya sakit mental pun, mungkin sakit fizikal sebab brain injury dan sebagainya, terpaksa minum susu, dengan duit tak ada, dengan wife tak boleh nak kerja sebab menjaga suami 24 jam, tapi dalam masa yang sama suami pun memerlukan rawatan 24 jam, maksudnya pemerhatian 24 jam. It is not easy. Whether sakit fizikal ke sakit mental ke, please do not be judgmental, because at the end of the day, the one that suffered adalah caregiver. Sebab kalau dah memang sakit mental, dia memang dah tak ingat dah, kalau especially schizophrenia ke dementia ke, dia dah tak ingat dah apa yang berlaku. Orang yang sakit brain injury, traumatic brain injury, dia pun tak tahu dah. Dia cuma tahu dia sakit lah, tapi dia nak cakap pun tak boleh. Maybe sebab dia dah ada expressive aphasia dan sebagainya. But again, kita yang sering menjudgementalkan orang-orang yang menjaga ni. So, hentikan stigma. And factors influencing the caregiver burden ni ada banyak sebab lah, kan. Caregiver attributes ni, okay, kita katakan age, okay. Duration of caregiving, semakin lama dia menjaga, semakin stres dia, semakin stressful. Kalau semakin tua umur caregiver, semakin cepat dia mudah mendapat stres dan semakin stress, burnout, depression. Workload depends pada caregiver attribute. Kalaulah dia caregiver, dia jaga, tetapi patient tu boleh je boleh jalan kaki walaupun dia macam ada intellectual disability, dia boleh jalan kaki semua, kiranya nak mandikannya tidak susah. Tapi kalau yang bedbound, nak kena angkat, nak tukar pampers, susah nak dengar arahan, itu pun boleh menyebabkan workload dia bertambah. Gender, education, perempuan lebih senanglah depres, kemurungan, sebab perempuan dia lebih banyak meluahkan perasaan secara emosi. Educational background, ya, income, employment status, sleep disturbances, coping style, understanding of disease, psychological state, relationship with patient. Kalau dia relationship dia bagus dengan patient, maksudnya caregiver tu mungkin tidak begitu stressful untuk dia, sebab daripada kecil mungkin dia tahu mak dia memang sayang dia sangat-sangat. Tapi you just imagine, I have a patient, kan, dia stres sebab dia kena jaga ayah dia yang nyanyuk, mak dia dah pass away sebab COVID. Dia kata, saya tak boleh terima, doktor, saya rasa nak marah ke ayah saya, sebab masa kecil-kecil dulu dia selalu marah kami, dia selalu pukul kami, dia selalu tengking-tengking kami. Tapi bila dia sakit macam ni, dia nak suruh kami bawa dia pergi jalan. Padahal dia tak pernah bawa kami jalan, doktor. Tak pernah pun. Kalau adik saya langsung lah tak nak pun. Adik saya langsung tak nak peduli. Adik saya memang tak nak. Kalau mak ayah saya menjerit-jerit, kata macam bawa je pergi jalan ke apa, dia kata tak kisah. Dia tak nak, dia buat tak tahu je. Doktor, saya tak boleh. Saya kena dengar apa dia cakap. Dalam hati saya rasa penat. Saya rasa letih. Dan saya rasa sangat tertekan dengan keadaan macam ni. Saya terpaksa berhenti kerja sebab saya sangat tertekan. Tapi bila saya berhenti kerja, tengok ayah saya rasa sakit hati. But at the same time, siapa lagi nak jaga dia? Kamilah yang kena jaga dia, saya lah. Ya. Dan patient attribute, ya, patient pula akan rasakan, ya, dia akan factors yang menginfluencekan caregiver burden ni. Kalau daripada sudut patient, duration of disease. Makin duration tu lama, chronic illnesses or schizophrenia, so makin sukar dia untuk dijaga. Severity of the disease, presence of the psychiatric symptom, level of behavioral disturbance. Kalau yang suka lari-lari keluar rumah, disorganized, suka wandering around, a bit difficult sebab macam patient yang intellectual disability tu tahu-tahu jumpa kat rumah orang. Tahu-tahu tengah malam dia ketuk pintu rumah orang. Tahu-tahu pergi masuk dekat dalam rumah orang. Kadang-kadang bogel dekat rumah orang. So all those things akan menyebabkan the caregiver akan rasa sangat stressful. Ya, functional abilities, kalau dia boleh jalan, okay. Kalau dia tak boleh berjalan, a bit difficult untuk manage dengan bed sore dan sebagainya. Poor quality of life, educational background. However, some of these factors are not conclusive, ya. Sebab at study in Malaysia among caregivers of patients of dementia found that a low external support received by caregivers was associated with caregiver burden. Maksudnya kalau dia tak dapat bantuan daripada orang luar, maksudnya lebih banyaklah caregiver burden. Tapi kalau finding in the Malaysian study, a study done in Italian caregiver of patient with the same illness indicated that the lack of social support was seen as having not contributed to a burden. Thus, ini ada yang mengatakan cultural differences in caregiving and coping style may also reflect the differences in the way of caregiving affected. Saya pernah jumpa ada satu patient ni dia jaga mak dia lah. Dia jadi patient sebab dia ada anxiety, tapi dalam masa yang sama initially dia tak boleh terima yang she has to take care of the in-law, padahal in-law tu tak pernah suka dekat dia. The in-law tak pernah, in-law dia suka orang lain, the in-law suka yang lain, tapi bila sakit tak ada orang lah nak jaga, dia lah yang jaga sebab dia tak bekerja, jadi dia kena jaga. Just imagine to live with the person yang who doesn't like her before, so she feels like macam kenapa semuanya dekat dia. Why everything was put on her, padahal tu not even her mother, tetapi dia yang kena. Bayangkan dengan keadaan dia nyanyuk dengan mak mertua yang suka maki dia terlebih dulu, jadi keadaan menjadi worsen, it accentuate the previous personality. So bila dia sakit memang sangat teruk. But I would say that she recover ataupun she has a very good resilience. Sebab dia kata, doktor, tak apalah, ini pahala untuk saya ni dia dah memang sakit dah, saya tak boleh buat apa-apa. Saya cuma tugas saya hanya menjaga. Ya, initially she was down, but finally she was able to accept. Dan bila akhirnya the mother-in-law to pass away, so she actually feel better. Dia rasa, dia kata, alhamdulillah dia dah menjalankan tanggungjawab yang sebaik-baiknya. So this is the 12 sign of the caregiver burnout. The person akan boleh dapat anxiety or depression, constantly feeling exhausted, neglecting your responsibility and needs, sebab dia pun dah jadi pelupa dah, sebab sibuk jaga orang, jadi sendiri dah tak jaga, sering jatuh sakit, ya. And because the immune system become reduced when you are stressed, so they always falling sick, and loss of interest in activities. And then they change in the sleep pattern. Macam mana nak tidur dengan proper kalau yang tengah malam tu dementia with BPSD, tengah malam berjaga, siang mengantuk, malam berjaga kan? Siang mengantuk, malam berjaga, mencari cucu di mana ada. Macam itulah. So the mother tu tengah-tengah malam tu dia akan bangun. Jadi the caregiver ni pun kena bangun jugalah tengah malam. So dia kena bangun tengah malam dan dia pun tak dapat tidur yang cukup. And then bila tak dapat tidur yang cukup, dia pun rasa kemurungan, dia pun boleh dapat appetite and reduce weight and appetite. Bagus juga kan, boleh kurus kan. Tetapi it's not good to suddenly reduce the weight unintentionally because the electrolyte imbalance may follow that, yeah. And feeling overwhelmed, helpless and hopeless, withdrawal from family and friends. This is quite common. Kenapa? Sebab ada parent yang bawa jaga anak sakit kesemuanya, anak autism. Macam mana saya nak bawa anak saya ada autism, ada ADHD, macam mana nak bawa pergi kenduri? Nanti orang akan marah anak saya terlompat sana, terlompat sini. Saya lebih prefer tak bawa dia orang pergi mana-mana. Saya lebih suka duduk dekat rumah, doktor. Jadi kalau orang tanya kenapa saya dah tak join aktiviti family, kenapa? Sebab macam ni lah, doktor. Kalau saya bawa, orang takkan faham anak saya ada sakit. Macam ni. Tetapi bila saya tak pergi, orang kata saya pula yang sombong dan tak pergi. So this is the dilemma that they are having. So resilience might be the key to explain how caregivers bounce back and deal with challenges in caring for individuals with severe mental illness. Apa maksud resilient and when you can be bent but you are not broken. So tak kisahlah sejauh mana pun ya dunia ataupun keadaan membawa anda pergi, tetapi anda boleh bounce back. Dia boleh di-bend, boleh dibengkokkan tetapi tidak patah. And you need to find a balance between caring for yourself and caring about what your family expects from you. So coping with the caregiver burnout. So the main causes, the prioritize the needs and interests of the loved one, have unrealistic expectation. Ini yang punca kenapa seseorang itu burnout ya. Sebab dia under unrealistic. I kena jadi anak yang baik, I kena jaga dengan baik, I kena jaga dengan bersih. Ya, and then lepas tu lack of support, duit tak ada, kerja tak ada sebab kena berhenti kerja, jaga the family yang sakit. Tapi dalam masa yang sama nak makan diri sendiri pun tak cukup because have to kena berhenti kerja. And they have to juggle with the multiple commitment. Ada yang masih bekerja, balik kena jaga, balik tanpa rehat. And this is the main causes that the patient ada caregiver burnout. Sign of the burnout, macam tadi kita cakap, boleh ada anxiety, depression, constantly feeling exhausted. People with burnout, dia akan constantly feeling exhausted. Despite rest, despite tidur, despite me time, tetap akan ada exhaustion. Neglecting your well-being, falling sick more often, changes in sleep patterns and changes in appetite or weight. Prevention tips, of course, set the realistic expectation because expectation is always kills. I always say that expectation always kills. Why? When the expectation is not meet up to the outcome, so that will lead to disappointment. And this disappointment is the one that actually make us feel very, very bad, very, very down. Embrace your role as caregiver. At the end of the day, you have no choice. Dan saya selalu cakap, seringkali hidup ini tidak meletakkan kita dengan pelbagai pilihan. Namun, hiduplah dengan pilihan yang ada. Sebab pilihan yang ada tu mungkin lebih baik daripada tiada apa-apa. Ya, and practice self-care. Of course, kena, walaupun kita kata me time pun akan exhausted juga. Ya, but at the same time, kadang-kadang pergilah bercuti. Minta tolong orang untuk jagakan the caregiver tu kan. Mungkin ada family lain, adik-beradik lain ya. Join a caregiver support group and take regular break, relax and meditate. 5 ways to cope with the caregiver guilt. Ya, sometimes kan bila jaga dengan mak kan, mak yang dementia nyanyuk, kadang-kadang kita marah, kadang-kadang kita macam kita jerit, mungkin sebab mak tu mungkin dah nak main api dan sebagainya, jadi kita jerit. Again, the caregiver akan rasa bersalah juga. Macam mana aku marah mak, berdosanya marah mak. Again, admit your mistake and apologize. Correct the situation if possible. Tak boleh, mak suka minum manis-manis tapi kita tahu tak boleh bagi manis-manis lagi, sugar tak control. Yeah, admit your mistake and apologize. Correct the situation if possible. Forgive yourself first before you can forgive other people. You need to forgive yourself first. Ask forgiveness from your loved one. Mak, minta maaf, bukan sengaja tak nak bagi benda manis, tapi kalau macam ni susah mak, nanti sugar lagi tinggi, kaki kena potong pula. And try to learn from the experience. Okay, where can I turn to for help for caregiver burnout? Sometimes the caregiver dah terlalu tua. Sometimes dia orang tak tahu nak pergi mana. Sometimes dia orang dah rasa memang dia orang dah tak boleh, dah at the end dah, memang dah tak boleh lagi dah nak jaga. So I would say, tapi I akan cakap, I'm so sorry I have to tell you this, yeah, but this is the last thing that if you want to consider, but this is the last thing is that home health services. For example, kita panggil agency untuk panggil nurses yang jaga. Kalau kita mampu, kita boleh panggil nurses untuk tolong jagakan ya. Boleh juga ada adult daycare macam kita hantar tadika ataupun taska anak-anak dan ambil petang lepas kita balik kerja. But again, tak banyak dekat Malaysia yang macam ni. And this is another thing is nursing home or assisted living facilities, which kadang-kadang bila family dah terlalu stress, dah terlalu sampai depression dan sebagainya. So sometimes this is the end thing that I will suggest is that to find a nursing home. But of course, I would say that there's nothing that can replace the children punya care lah. And of course, as kalaulah orang tua tu boleh bercakap, they would say that I wanted to, for the last breath that I have, I wanted to spend the rest of my life with the loved one. But again, sometimes the loved one is maybe, itulah orang kata what you reap what you sow. Kadang-kadang bila kecil-kecil kita tak nak tengok anak kita, kita tak peduli anak-anak kita. So sometimes bila dah besar mereka juga tidak mungkin mempedulikan kita. But ini adalah ingatan untuk diri kita sendiri kan. Tetapi as a caregiver, apa lagi yang mampu kita buat? Again, kadang-kadang hidup tidak memberikan kita banyak pilihan. But live with whatever things that we had, because sometimes the only things that we had is better than we have nothing. Yeah, and private care aid, caregiver support services, this is commonly dalam Facebook ke IG ke ada caregiver support services where they actually macam share the story how they take care of the mother, how they take care of the children. And I was with the autism support group, in which sometimes they will ask me the question about how to care for the autistic child. But most of the time they were supporting each other, in which I can see that how the support is very, very good. This person will help the other person in managing the children's behavior, and that's very good. An agency of aging, we don't have it here, I think. We don't have the agency of aging, yeah, and national organization is probably look at the phone directly that or search online for a local agency or chapter of national organization dedicated for assisting people. I think last time I've heard that we are planning to do that untuk jaga caring for the this national organization. Ada satu tempat which is macam Jepun, ada satu tempat di mana dia memang jaga for the person yang dah elderly and the person with mental illness yang chronic. So where they actually send the person there, but they're living in the house yang memang sangat best lah. Ada banyak reminiscing therapy, music therapy and so on. And we are yet not there. So I think the Super MD apps is recently built. And the CEO tu ada contact I last time about the Super MD apps. I tak sure macam mana ejaan sebab I pun lupa nak get back to that person. But he mentioned that the Super MD apps is that like macam kalau kita duduk jauh, but ada orang yang tolong jaga mak ayah kita kat tempat jauh, so kita akan bagi macam that Super MD apps ni akan ingatkan what time untuk makan ubat, pukul berapa makan ubat, and then lepas tu kalau dah makan ubat, okay good. So this apps is actually interactive app for the actually caregiver yang jaga the mother yang chronically ill. So dalam masa yang sama dia akan remove lah the rasa guilty anak yang tak dapat nak jaga the parent tapi orang lain tolong jagakan. Yeah, I mean some sort of like that. Tapi dalam masa yang sama that apps ingatkan tentang bila nak makan ubat, what time. Kalau doktor tukar prescription, so the doctor can directly put into the MD apps ni dan lepas tu the caretaker tu akan dapat tahulah ubat apa. And lastly, I will end with this sajak, which I tak tahu lah sajak ke apa ke poem, but I love this. Okay, but hold the mother, not the baby. Because the baby is being taken care of, fed, snuggled, and given all the love in the world by not only the mother, but her partner, grandparents, siblings, cousins, and friends. But the mother may have gaps in her mind from lack of sleep, may be mechanical in her motion, as she's healing, may feel more like a mess than a mother, may be sitting in bed crying, feeling overwhelmed in her body and life. May be full of mom guilt because in her mind she's not good enough and she's bleeding, wincing in pain, swollen and emotional. As the mother, and the mother that's baby's whole world and needs to be seen so she doesn't disappear into that postpartum fog. So hold the mother, not the baby. A mother agrees that her baby matters more, but she's hurting while she's the person behind the baby in the background, making it all happen, feeding her baby at all hours, snuggling her baby close to comfort, newborn cries, and being that baby's everything. So it's the mother who needs your love, and a mother will remember who held her up. So instead of I'm coming to see the baby, try to say, I'm coming to see you and meet the baby too, because the mother is the one that need to be helped, not the baby. So I think that's all from me. So kalau ada soalan mungkin boleh tanya. Thank you so much for your kind attention. Yes, back to you, Dr. Faiza.
Okay. Terima kasih ya Dr. Syuhaida. Banyak yang kita belajar hari ini tentang macam mana untuk memberikan support system, memberikan support, especially psychosocial support kepada caregivers ini. Sebab selalunya yang kita nampak mengalami masalah, yang mengalami kesusahan hanyalah pesakit. Kita rasa orang yang memberi bantuan, memberi penjagaan kepada pesakit itu semuanya okey. Tapi kadang-kadang mereka sendiri tidak terluah tentang apa masalah mereka, tentang apa cabaran yang mereka hadapi. So daripada semua yang telah Dr. Syuhaida berikan kepada kita hari ini, sekarang kita dapat tahu, sekarang kita dapat aplikasikan bagaimana untuk memberikan support yang sesuai kepada caregivers ni. Setakat ni saya tak nampak pula ada apa-apa soalan daripada penonton. So saya rasa Dr. Syuhaida telah menjalankan tugas yang sangat cemerlang. Semua orang faham ni nampaknya.
Faham lah kot
Faham. So nampaknya sampai di sini saja Dr. Syuhaida. Terima kasih banyak-banyak daripada pihak SEHAT dan juga sebagai mewakili para penonton semua. Dan kepada semua penonton, terima kasih diucapkan di atas kehadiran anda. Semoga ilmu yang kita pelajari hari ini dapat sedikit memberi manfaat kepada diri kita dan juga dapat kita sebar-sebarkan untuk keperluan insan lain, insya-Allah. Setakat itu, sekian saja daripada saya, Dr. Faiza. Terima kasih dan jumpa lagi minggu depan. Assalamualaikum.
Waalaikumsalam. Thank you so much, Faiza, and thank you everyone. Bye-bye. Assalamualaikum.